Greetings from Boston, everyone. Welcome to our third program of the series, COVID-19 and the New World Order. Today, we are focusing on India. On behalf of Northeastern University and myself, I hope you and your family are staying safe and healthy during this turbulent time. As an institution, we are putting our resources into helping to find a cure for the COVID-19 disease. We have faculty who are focusing on their efforts on mapping the spread of the disease, preparing the next generation of highly skilled, versatile, and enterprising healthcare leaders, educating the public about COVID-19, supply chain, community resilience and response. And I'm sure we all realize now how important community is and how wonderful it is to see so many of you today with us. Before we proceed with the official program, I would like to make a few announcements. First, make sure the program runs smoothly. Please remain muted during the event and keep your video off. We are taking the attendance, so if you please rename your profile with your full name or type it in the chat box. You can use the Q&A box for questions, which Professor and our panelists will respond at the end. And now I would like to invite Mumbai community leader Pranav Adnani, who graduated from Northeastern from DMSB, Dimon Markin School of Business in 2015. Pranav.
Thank you for that introduction, Yelena. And a big thank you for all the panelists as well as the participants who joined in today. This is Namaste from Mumbai from me, Vidhi Rajpal, as well as Chirag Doshi. The three of us are a part of the NU Mumbai Leaders Community, and we founded this chapter back in 2018. And Vidhi herself is from, she's working at Disney, and she is from the Dimon Markin School of Business, class of 2015. And Vidhi, if you can just wave your hand so everyone knows who you are. And we have Chirag as well. Chirag, he's from the College of Business Administration. The name changed later, but yeah, he graduated, I believe, in 2001. Chirag, if you can just wave your hand as well. And so yeah, I myself, for that matter, I graduated in 2015 from the Dimon Markin School of Business, and I run 2 companies in advertising as well as tech. So just to give you all a brief, the entire aim of the Mumbai Leaders is to keep our Mumbai community engaged and connected through various activities, speaker sessions, meetings, and just to grow our reach and reach out to everyone, the alumni, the parents, the prospective, as well as existing students in Mumbai at Northeastern University. And, this is a great platform for us as well, for all the Mumbai community to kind of get together and, engage in the discussion for COVID-19 and the New World Order. And that's a little bit about the Mumbai community. And I'm just going to tell you all a brief about the coming discussion. And I'm sure Yelena will obviously lay more light on that. So this is a special series which is going to be, discussing the impact of COVID-19 around the world. I believe that 2 sessions have happened already. One happened in Thailand and one in Brazil. And, like we know, because of the COVID-19 situation, the ongoing pandemic, it's testing the quality of governance in countries around the globe and raising questions about elected officials. We have an esteemed panel today. We have Dr. Nikos Passos, who's the professor of criminology and criminal justice at Northeastern. And we also have Ms. Deepak Sandhu, who's the fellow Indian Council for Arbitration and member advisory board, Anti-Corruption Academy. And we have Mr. Umar Siddiqui, who's the president of the Anti-Corruption Academy, ACA, and entrepreneur, social reformist education. So it's a great pleasure to have you all join us today. And I'd be handing it over again to Yelena to take things forward. Thank you.
Sure, thank you, Pranav. That was a great introduction. Ladies and gentlemen, let me introduce you to Professor Nikos Passos, Professor of Criminology and Criminal Justice at Northeastern University. Nikos is co-chair of Steering Committee for the University of Geneva Anti-Corruption Academy, distinguished visiting fellow at the Institute for Advanced Studies at the Law School, University of Birmingham, distinguished visiting professor at the Beijing Normal University Law School, distinguished practitioner in financial integrity at the Financial Integrity Institute at the Case Western Reserve Law School, and chair of Academic Council of the Anti-Corruption Academy in India. He serves on the Global Advisory Board of a Transnational Alliance to Combat Illicit Trade, the International Panel of Advisors at the Institute of Australia-India Engagement in Brisbane, and the Board of Directors of Compliance and Capacity Skills International in New York. Without further ado, Nikos, to your floor.
Thank you very much, Helena, for the kind introduction. Thank you, the panelists and all attendants. Welcome to our webinar. So today, our review of quality of governance in the time of a pandemic turns to India, the second most populous state in the world, a real subcontinent, and part of the BRICS, a major emerging market, an important economy, and still growing, with a number of specificities. And this is part of what we have been trying to do in our webinar series, to take a look at some general challenges that everyone faces, but also to look at the particularities and the context in different regions, in different countries, and the way in which they have been able to respond, how prepared they were in advance in their health system and infrastructure to deal with an emergency like this, how quickly and how openly they responded. The quality of leadership we have seen very differently from examples in New Zealand, for example, all the way to all kinds of problems that we discussed last week in Brazil, where many dysfunctions, as it happens, may be costing lives as well as economic costs. And the specificities, however, in India are just too many to mention. We're talking about a country with a colonial past and a number of languages, religions, and inequalities between rural and urban populations in infrastructures. We have a caste system that is officially abolished, but with a hold still in place. And we also talk about a country that is vulnerable to natural crises. We have earthquakes, we have cyclones, we have floods and landslides and droughts. And one would expect a huge country with 1.3, 1.4 billion people dealing with crises like this all the time to have a degree of preparedness on health. And yet we find that the spending on health is lower than the world average. We have all kinds of issues, and this is going to be very important to, we will have on our panel someone who has been working on freedom of information and freedom to information, for information in India. And this has been an ongoing controversy on, we have seen hundreds of doctors and professionals calling for accurate information so that they can protect the healthcare of the workers and promote the common interests in different parts of the population. But at the same time, there have been allegations of undercounting, misreporting, similar to things that we saw before with respect to tuberculosis. We have seen complaints about policing the crisis as opposed to managing the crisis, making arrests, targeting populations. We have seen emergence of fraud and corruption patterns. We have seen in other respects a drop in these activities also, as especially the economy shut down. We have seen other momentous events in recent years, such as demonetization in India, that had an effect on the economy, it had an effect on small businesses, and it was expected to do something about black money and corruption, but unfortunately we have seen new patterns and other ways in which corrupt actors have adopted. In general terms, in governance terms, we see that India ranks on the perception index that Transparency International puts up every year as the 80th country out of 198. The Harty School of Governance ranks the overall score of India 71 out of 117 countries, with some interesting variation. For example, in judicial independence, India scores 38th out of 117. In administrative burden, 76th out of 117. In trade openness, 73. In budget transparency, 88th. In e-citizenship, the worst score, 93 out of 117, which is interesting in a country that is innovative and has a lot of technological talent. And when it comes to freedom of press, it ranks 49. The Global Corruption Barometer found, that is the most recent, this is not 2019 or 2020 ranks, but 2017, but 63% of public service users paid a bribe in the previous 12 months. So self-reports suggest that bribery is a continuing problem. The previous health minister in 2014 actually made a public statement to the effect that India's healthcare system is riddled with corruption and the National Drug Approvals Agency is a snake pit of vested interests. So these kinds of official statements tell us that this is, 6 years ago. Hopefully progress has been made since, but corruption continues to be a problem. Serious misconduct is a problem. And we note also in India the tendency we see in other countries to focus on small time and low level corruption among the poor and the least powerful, as opposed to big time corruption. And we have also a lot of good practices and traditions to see. For example, it was India that started a tradition followed by Indonesia, Kenya, and Greece, to have a website where people reported that they paid a bribe, the IPaidAbribe.com, where citizens would go and explain that in order to get a service from the government, they had to pay for what they were due, what they had a right to access. Anyway, we have seen the emergence of I didn't pay a bribe.com kind of practices shining a light on the integrity examples that we can find in the country. And in Bangalore, we have seen also a wonderful example of community-led participatory budgeting. So there are things to learn, and we look forward to hearing from our panelists and you, the audience, your views and the special issues that arise out of the pandemic crisis. With this, I would like to turn it over to Umar Siddiqui, who is the president of the Indian Anti-Corruption Academy and the managing director of Global Pact International Holdings. That is a business and technology international company. In the past, Umar has managed a number of software design and development teams in big companies and spearheaded the creation of Effect Plus. And the most notable accomplishment of that was the restoration and coloring of the Indian classic film Mughal-e-Azam for the CinemaScope release. He is the managing director of the Indian Academy of Arts and Animation and has received many awards for his contribution to IT and the media industry. The founding member of the Animation Producers Association of India and a permanent member of the Association of Motion Pictures and TV Program Producers. With this, Umar, please, you have the floor.
Thanks a lot, Professor Pasas, for the kind introduction. Thanks to all the organizers, our students at Northeastern University, the alumni students of Northeastern University at Mumbai chapter, the Northeastern students and community in India and all over the world, my dear colleague, Madam Deepak Sandhu, ladies and gentlemen. It's a great honor and a great opportunity to be with you all today for a meaningful deliberation on this current crisis. I will not go into the numbers and a lot of statistics because you all know very well. Everybody is having an iPad or a smartphone nowadays. So numbers and all these things are available. And we all are facing this crisis in every part of the world. The world is deeply affected. And I always say that this is the first time in the world that almost 95 to 98% of the world is badly affected. Emotionally, sentimentally, financially, and economically. Somewhere the damages are huge, somewhere the damages people they are able to dilute. And this is the time when we are not here to criticize the governments and the state governments and the central governments. It is the time for a sincere evaluation that how we have received this pandemic, what were the measures we could have taken in a better manner. One thing we all need to understand, that this time of crisis, it happens once in a century. So even our government, whether it is state government or the local government or the federal government, it's not an easy task, particularly when you talk about the size of a country like India, where diversified segments, different castes, different religions, ethnicity, languages, segments, villages, districts, different state governments, union territories, federal government, a lot of issues are there in our country when it comes to governance. When I say issues, it means it's a gigantic task to handle these things. And when you embrace a pandemic like COVID-19, it's a cumulative responsibility of individuals, the local bodies, the state government, and of course the federal government as our guardians. Now I start that I will just go and a little bit of the overview that when we received the first case in India around 30th Jan, we were not knowing that we will be having such a level of curfew and lockdown in coming 50 to 55 days. I think nobody could have imagined this thing, that we are going to embrace and we are going to see this thing. And that is the case with every nation. That is not only the case with India. Somehow, what we have analyzed, that a backup plan in the month of Feb or in the early March was required in three areas. First, the healthcare infrastructure. When I say healthcare infrastructure, it involves the address and the upgradation of the present infrastructure, and also having the new infrastructure to be in place. That is the must, because the number of beds per 100,000 like population in India, the number of hospitals per 100,000 in India, the number of doctors, the number of healthcare staff, all these things we have a very, very negligible figure. So that was one of the basic requirements which was required at that point of time. Secondly, the healthcare infrastructure also include that when we are going to basically enter into a full-fledged COVID-19 scenario, how we are going to take up that entire thing on day-to-day basis.
I'm interrupting
for
for
example,
a moment, Umar. I'm sorry, I can't hear you at all for the last 2 minutes. Just forgive me, I will come back. I've just checked what's gone wrong with my system. Please carry on. Okay. I'll come back because I can see you, but I can't hear you. I'll come back.
Okay. Others can hear me?
We can't hear you, so don't worry about it, Umar.
Okay. You can hear me?
Yes. Please carry on.
Okay. So, when you talk about healthcare infrastructure, it includes both. As I mentioned that the healthcare upgradation, the new healthcare setup, also the basic healthcare requirement for each and every citizen of India or any nation, what we are talking. But today we are talking about India. So to provide the sanitization, to provide the sanitizers, the mask, all these things, along with the required information. So that was one of the area where I think we could have started at a better pitch, and somewhere we are lacking in that area. Of course, a lot has been done in that scenario, but that was done like sometime in the mid of March or something like that. The second area which I would like to cover, and I'm going a little fast because we have to cover a lot of things. The second area is about to address the issue of migrants and workers. India is a place where a lot of migration happens in search of jobs. Of course, now the big states like Bihar and Uttar Pradesh and West Bengal, they are having now big infrastructure, industrial infrastructure. But even then, their absorption power of the entire workforce locally is not so much. So people in search of jobs, opportunities, they always migrate to places like Bombay, Delhi, Bangalore, Hyderabad, and different places, different cities in India. One of the biggest concern, and I think you all know very well, that the way we have tackled, I will use the word we, the way we have tackled the entire migration and the entire workforce, that is not at all acceptable for a country like India, where people always take care of each other. And there I think we completely miss a great opportunity in terms of the creation of the required infrastructure, the transportation, the entire modalities, the functioning, the transformation of the information to the workers, to the migrants at each and every level. Unfortunately, it happened that even when the pandemic started and the lockdown was announced by the Honorable Prime Minister, even after 40-45 days of the lockdown, we were not able to address this issue. Fortunately, I will say fortunately, the role of the private players, the role of the private companies, NGOs, individuals, not only the rich class, even the lower middle class, even the middle class, the NGOs, the selfless Samaritans and volunteers, they have contributed significantly for this entire campaign. And I think that entire contribution we can't forget. As we have Corona warriors in the form of our healthcare experts, which I will definitely come and address that, like doctors and nurses and our policemen and other people, in the same manner, the role our NGOs and the volunteers have played, that is a great role they have contributed. Otherwise, we would have had more casualties, more fatalities, and more damages for this entire thing. That was the thing where we required a very, very important, role of governance from the state government side as well as the central government side. Third area is the overall economy. You all know very well that when we entered into the COVID-19 scenario, India was not in a very good situation in terms of economy. Even in the month of Feb and the early March, or you start the early 2020, we were facing these issues in terms of economy. Our manufacturing sector, our industrial sector, our IT sector, our agriculture sector, the employment scenario, the banking sector, the financial industry, a lot of it requires at least 5 to 10 webinars to discuss each and every aspect and to address those things. So I will not go deep into that. But unfortunately, when we entered the pandemic, to address the economical situation and the implication on economy, like because lockdown, we all accepted what our central government and our honorable Prime Minister, when he announced that, and I always give the best of respect to him that whatever he has decided, he had definitely the best of the intention when he announced the lockdown, because at that particular point of time, there was no any option but to do this thing, because there are different issues in India. The lockdown was required, but the entire lockdown till date had to be addressed in a more systematic and organized manner. So these are the 3 areas where I think the governance would have been a better, but I will always come back to the thing, the role of the private players, the role of some of the state governments, the role of some of the state departments, I think was phenomenal. And I think we should salute them for that particular thing.
Thank you very much, Omar. Next, we have Ms. Deepak Sandhu, who is a fellow at the Indian Council for Arbitration and a member advisory board of the Anti-Corruption Academy. She served as member of the advisory group for the Right to Information Assessment and Advocacy Group and the Center for Equity Studies in partnership with the UNDP for the implementation of the Right to Information Act in India. She developed draft rules for the Whistleblowers Protection Act and has served as Director General at All India Radio, Director General and Head at DD News Channel, Director at the Directorate of Film Festivals, Press Register at Newspapers of India, and Director Media Relations and Spokesperson for the Ministries of Finance, Commerce, and Health and Family Welfare. It is a pleasure to welcome Ms. Deepak Sandhu. Please, you have the floor.
Thank you very much, Professor. Thank you for inviting me to participate in this very interesting and very topical webinar. And I agree, I'll start by saying that I agree with what Omar has said, that the scale and size of the problem in this country is huge. It is there for all countries. The pandemic has hit all countries equally hard, but India is a very, very populous country, and that adds an additional dimension to the problem, which perhaps other countries may not have been facing. The governments at the state level and the central level have put in their best, as have undoubtedly the NGOs, the private organizations, individuals, and so on. Otherwise, solely by a government effort, this would not have been possible to handle it even at the level that it is today, when the numbers are still growing and we are trying to combat that. But I will make a few, I don't want to say critical, but I would say analytical comments about what could have been better. And I think we will all take it in the spirit that this is more like a looking back, which is much easier thing to do than at the time when you are at the heat of the moment having to take decisions. So I will look back at some of the things that have happened over the last 3 months and make a critical analysis and recommend that perhaps as we go forward, we can improve on those areas. I'll start with the problem of migration of labor, because that touches human lives. The exodus began soon after, from the big cities, soon after the announcement of the lockdown on the 25th of March. And they were given only 4 hours by the government to make way to their homes. So a huge transmigration, which has been described as the greatest internal transmigration in India's history, began, and millions of people began to crisscross across the country in the scorching heat of the Indian summer, without food, medical aid, without protective gear. And all this was a tremendous cocktail for the spread of the virus, and also a very huge human tragedy. And what I would like to say that it was known to all that as per the 2011 census, there were 54 million people who were interstate migrants. So this large number was known. And 54 million is actually an underestimate because it doesn't take into consideration the circular migrants, the footloose migrants, the occasional migrants. So the number was quite huge. And I think there should have been more time for the migrants to have been allowed to go home, and proper arrangements should have been made for their travel and their receiving at the other end, because of Corona, we have to make arrangements for quarantine, etc. Time should have been given for that. And as the experts point out, that because of this lack of proper planning while announcing the lockdown, in early March, if opportunity and arrangements were given to the migrants to go home, there would have been fewer carriers of the virus. Now, 2 months later, as the central government belatedly made arrangements for trains and buses, tens of thousands of people are carrying the virus back to their home districts. I think this will only exacerbate the already problematic situation that is surrounding us. The Prime Minister made 5 speeches from mid-March to the 31st of May. In the first 4 speeches, there was no mention of the word labor or laborer or migrant laborers. And as a matter of fact, on the 31st of March, the Union Home Secretary and the Solicitor made a statement, and the Solicitor General of India informed the Supreme Court that there was not a single migrant laborer on the streets of the country. And then 12 days later, they informed the Supreme Court that 1.4 million people were in camps and 10.3 million were going to food camps. And later the Supreme Court was informed by the same Solicitor General of India that as many as 9.1 million persons had been transported to their home states. Here definitely better planning should have, and better thought should have been given to the pre-lockdown scenario. The second thing, this was bad enough for the financially weakest section of society, but then began a violation of human rights, particularly the right to freedom of movement. A chief minister of one of the southern states, he actually made a request that the trains from Karnataka going out of the state carrying migrant laborers should be cancelled because the builders' lobby in that state felt that if the laborers go, their projects would not be viable. Now, while one understands that you have to help the builders' lobby to carry out successful projects, but not at the cost of the treading on human rights of the disadvantaged. One state suspended, and that state was is ruled by a BJP-led government, which is the party in power in the center. They suspended 38 special trains meant to transport migrant laborers. Some states even refused to accept laborers because they said we don't have proper arrangement to receive them, such large numbers of people. So all in all, it was the weakest section that was not treated at par with the more privileged sections, I would say, in this very difficult time. Then again, another thing happened. We found that certain labor laws suddenly changed, infringing on workers' rights. In early May, 3 BJP-ruled states and 2 Congress party-ruled states extended the working hours from 8 hours to 10 hours. Mind you, they'd made it 12 hours, but then they realized that they have to have a consultative process with the unions before they make it 12, so they quickly brought it down to 10. And this, as we all know, is an inefficient way of making workers work, because the 10-day rule has been there for the last 100 years, and it has been a sterling rule, keeping in view the capacity of people to deliver. The state government, and this was done under Section 5 of the Factories Act, which is called into operation in case of national emergency, war, or internal disturbances. So special powers were invoked, which perhaps were not required to be invoked at this time. And UP has, on the 6th of May, the central part of India, they've decided and they have issued an ordinance to suspend 35 of their 38 labor laws for the next 3 years, stating that this would attract much needed investment to an economy battered by COVID-19. And this means that several key laws, the Minimum Wages Act, trade unions, settling of industrial disputes, occupational safety, Health and Working Conditions of Workers and Contract Laborers Act will not apply to the state of Uttar Pradesh for the next 3 years, and this will be the cost of the laborers again. And only 3 laws relating to safety and women and children, I mean, these will be in operation. The rest have all been suspended for the next 3 years. No pre-legislative consultative process has been undertaken. No, I mean, all the requirements were not met before this ordinance was suddenly issued. The social crisis is part of the humanitarian crisis is a part of a broader social crisis that the country now confronts. Indian society has always been deeply hierarchical in terms of class and caste, and deeply prejudicial in terms of religion. And the burden of suffering has fallen disproportionately on the economically disadvantaged. Unfortunately, the religious profiling by some of the ruling party members of parliament and some senior government officials made India's Muslim community more insecure. And the statement that came from the Prime Minister that the virus does not recognize any religion came late and only after sharp criticism from some of the Gulf countries. Having said that, I would like to come to a more, I mean, these issues that I've raised are more for reflection so that these things can be looked into deeper by state governments and corrective action can be taken. But what is very welcoming was that the National Informatics Center of the Government of India has made an app. It's called the Arogya Setu app. This app is an Indian open source COVID-19 contact tracing syndromic mapping and self-assessment digital service, which over 100 million persons downloaded in the first 40 days. This is a mobile application. It proactively reaches out to and informs users of the app regarding the risks, best practices, and relevant advisories pertaining to containment of COVID, and it is available in 12 languages. So this is really a commendable step taken by one of the agencies of the central government. Education during COVID times. So I'll just talk briefly about this. The next big race is going to be how to make money from online education. But we have to be careful while garnering the benefits of movement in this direction. Lots of teachers will probably be laid off. The societal interaction between students will be curtailed, which has its own negative impact. And millions of poor students without smartphones or computers will be affected, thereby creating an education divide, which already exists. It will deepen the education divide. So we have to be a bit careful to guard against these while garnering the benefits of online education during the short term. Now, future economic policies of not only the central government of India, but other countries as well. A whole generation of young people have grown up believing that there is no economics other than neoliberalism. Switch back to the present and you find that in Europe, there is a serious rethink on the economies of the market. Countries are trying to move back to their welfare moorings. For example, Spain and Ireland have completely nationalized their healthcare facilities for the duration of the crisis. In India, Maharashtra, after about a month of seeing how the partnership between private and public sector healthcare facility institutions work, they asked and they took over 80% of the hospital beds by the government agencies. Chhattisgarh state, which is more of a tribal state in the heart of the heartland of India, the central part, they very early on took over all the hospitals of the state and began to run them as state institutions. And their record has been absolutely outstanding. They have, like Kerala, been able to hold back the pandemic in a big way. Delhi government is moving the same direction currently, where the coronavirus doesn't seem to stop growing. I will admit that the private hospitals have contributed, but there have been serious complaints of overcharging and corruption. and corrupt practices in private hospitals, that has been a bit of a dampener, I would say. So I think later, as we come out of this crisis, we will have to watch how the public sector and private sector in the medical field will work, and how the private sector hospitals will come out and take responsibility and become a stakeholder in public health. I mean, they do get lands either free of cost or at very nominal rates from government when they set up these institutions, hospitals. Now, marketing and perception building, which are two vital functions of neoliberalism, continued to play center stage even when the pandemic was looming and the Indian government was well aware of the situation. In late February, an event named Namaste Trump was held in Ahmedabad, which is in Gujarat, in a huge stadium which accommodated over 100,000 people, and they cheered and clapped while President Trump and Prime Minister Modi played to the gallery. The government was most unmindful of the consequences of this mega PR act. I come to the social media. They joined the chorus along with the electronic media that the coronavirus is an Islamist conspiracy, and at the same time, that the Chinese are responsible for it. But it must be said to the benefit and credit of the government that legislation was passed very quickly, which prescribes a punishment of 3 years in jail for spreading false rumors. So that was put to halt. Now I want to touch upon a very important thing which talks about transparency and funding. The government set up a PM CARES fund, which is very similar to the National Defense Fund, which is already in existence. And this was set up by the government on 28th March. The office of this fund is shown as the Prime Minister's office. The Prime Minister himself is the ex-official chairman. The members of this fund, of this trust, it's a trust, are the Union Home, Finance and Defense Ministers. And this fund received an equivalent in rupees of $1.27 billion in the first 52 days. Now, I'm talking about this fund because it's absolutely opaque under the RTI, Right to Information Act. They have refused to divulge any information about this fund, where the money is being spent, on what are the issues which have come up before the trust and what they're funding and what they're denying. The second thing is that this fund is not going to be audited, unlike the National Defense Fund, which is audited by the Auditor and Controller General of India. This fund will not be audited. Now, having retired as the Chief Information Commissioner in the Central Information Commission, I'm particularly anguished by this move of the government and the opacity that surrounds this particular fund, especially because almost 50, a little less than 50% of the fund is contributed by deduction of 1 day's salary of government employees and donations from government agencies. And about 50% of the funds have come from private sector companies from their corporate social responsibility funds, and donations by private companies, industry bodies, and social organizations. I will also suggest that perhaps there's a political hue to the donations which are coming to this fund, because 3 or 4 companies which I was looking at, either they have been holding back wages, or they've announced pay cuts, or they've laid off employees, but they're donating generously to this fund. So it appears that there is maybe a political coloring to this kind of donation. The medical crisis that has faced us, I will quickly wind up, is likely to impact 2 areas. One is where the serious illnesses like tuberculosis or heart disease and other ailments, the normal facilities that were available to the patients, most of it is being diverted to COVID, so they are having more trouble accessing medical care. And the institutional structures, the institutions that was set up for giving vaccinations to millions of children who are born in India every month, they are also bending towards COVID management, their resources. And so the vaccination programs for diseases like polio, measles, mumps, diphtheria, etc., they the state governments perhaps are falling behind in the immunization programs. We'll have to pay attention to this. It's a very, very serious and important issue. Unemployment has gone up from 7% to almost 27% now. That is a problem that will have to be resolved not only by India, but by countries across the world. And India, I feel the amount of money that has been put, the funds that have been put in to rev up the economy are just not adequate. It's going to take much more than that. The financial stimulus will have to be upped. There is another aspect, human aspect, the looming psychological crisis. For those who were left jobless and left to walk back alone, maybe they won't have the confidence to come back to the cities they left, where they found work. The school children and college children who are abandoned and expected to look after their own interests suddenly overnight. And the economic insecurity could lead to a spike in mental health issues and depression, having long-term impact on families. That's one area that, again, public health workers and planners will have to work on. Indian federalism is weakening. The states are not getting their share of the funding. They have been crying out to the center. Indian democracy is very strong, foundations, but there has been no meeting of parliament, no e-meetings of parliament or virtual meetings. That is a bit worrisome. The National Disaster Management Authority, they've done a super good job when they made arrangements to evacuate more than 100,000 people from the western coast of India when during the pandemic, cyclone Nisarga hit out. And there were, I mean, I don't want to use the word only because even 4 deaths are one too many, but there were 4 deaths and 100,000 people were evacuated. So I think that has been a strong feature during this time. The judiciary has been most proactive. The Delhi High Court, in the recent decision, gave an order on June the 11th. And this Delhi High Court's order stands out as one of the most important interventions by the judiciary on food security during the coronavirus pandemic. And millions of people were given free food and are being given free food on account of this. The Supreme Court has been very proactive and took notice of the migrants issue and directed the central government to provide free transport, food, etc. So the judiciary has stood like a rock. The NGOs and private organizations, and individuals, as Umar said, have been sterling in all this time. Just a few, in the conclusion, I would say, the government must recognize that this problem, this crisis is multidimensional, and the nation needs to work on many, many fronts to overcome this pandemic, other than, of course, the health issue. The Prime Minister must consult opposition leaders with ability and expertise. He must also rely on experts in economics, science, and public health, and shy away from taking decisions on the basis of their political gains and potential dramatic effect. I'm afraid that has happened a couple of times. The ruling party must give equal treatment to the states that are ruled by them and those that are not ruled by them. And last but not the least, the government must show a more compassionate face to the disadvantage of our society, as presently very little has been done to alleviate their personal and economic pain. So I think with these few words, I don't know if I've overpassed my 10 minutes,
Thank you. Thank you so much. You have already answered one of the questions, which was what should the government do going forward with your last few remarks. We have seen some of the questions coming in and have some of my own, but I would like first to ask Vidhi, Pranav, or Chirag if they want to have a question to ask first.
Hi, everyone. So I believe that if we can go ahead and take the questions of the participants first, so then we can probably see what they have.
So the three of you do not have any questions to ask first, right? You are the privileged ones.
We have a couple of questions actually, and we've got some great questions from our audience. So it does overlap. I'm just going to combine a question from someone we've got. So my question is, currently we are in the midst of this pandemic. we don't know if the data that's coming out is valid. Is it concrete that we can believe, 100% of it, because we're not sure of how much is being reported. Do you think you can maybe comment on the statistics and the transparency?
I think, Deepak, madam, you can put your views and then I will put something up.
Yes, more transparency is certainly required. No doubt about the figures. There have been suggestions that there is underreporting, but I would not like to believe everything that comes on the social media. And what is the other part about all the figures? Yes, as I said, there are suggestions that there is underreporting. Some doctors known to me have said that in Delhi there's been underreporting, but in spite of the underreporting, we can see that it's helping in India. The numbers are rising, but testing is rising, and more happily, the recoveries are rising. So the recovery rate was more than 50%. So that was more positive. Like Umar said, the frontline coronavirus warriors, as the doctors and nurses and the supporting staff are being described, they're doing their best. Yes, one thing that India stood up and very favorably, we were not manufacturing any PPEs or masks, but very quickly, a large number of local companies, along with some foreign apparel like Banana Republic and some others, they've got together and they are manufacturing a sizable number of PPEs and masks. That itself is positive.
I think one area, just to answer your question, one area where we need more transparency, that there is a lot of intermixing, and there is a lot of dilution of the normal deaths versus COVID deaths. That is an area where people are facing a lot of issues. There are instances which we have got live information from different cities and states that somebody has been admitted for a heart disease or for a kidney ailment or something like that. But when a person enters there in that atmosphere, unfortunately, he gets COVID. So somewhere there is a lot, over-reporting also, under-reporting is also there, over-reporting is also there. So that is an area where I think a very transparent, a systematic, because why government needs to hide anything? At the end of the day, we all understand that there is a problem, there is a pandemic. We need to address that. Now, in order to give a boost to this entire thing and how we can tackle it, it's a very important thing that we can't just depend on the government machineries and the doctors and the healthcare staff. There is a big lacking where the counselors and the NGOs who can play like they have played in the migrants case in the same manner attached with the hospitals, the healthcare staff and all, because there are a lot of issues when like somebody is dying. Now from that process to the funeral, to the burial, a lot of issues are there. People are helpless. And that is giving such, I'm telling you, a lot of people are calling us, they are not afraid of COVID. They are afraid that God forbid, if I will embrace death or something happen to me, what will happen for my funeral? That is the situation people are getting out of that. So I think it is the duty of state, the federal government, along with the NGOs and the private players, and a lot of Samaritans and volunteers are ready to go out of that. Even the community leaders, even the religious and spiritual leaders should be taken into the confidence. The Pandits, the Maulana, the Imam, the Father, all those people should play a pivotal role in this entire thing. And I think we can address this in a beautiful manner. This is the basic right of our brothers and sisters who are like departing from this world, that we should give them a respectful like funeral and the departure. So it is not only a matter of like the reporting of the cases, it's a matter of the entire transparency, as Madam Sandhu mentioned, that the entire philosophy of transparency, because that is the basic, ingredient of a good governance. Transparency, effectiveness, efficiency, all these things are required for that.
I'm trying to combine several of the questions because everyone is coming at the same time now. We see that in a number of ways, by the health crisis itself, but also from many of the responses like the timing and the planning of the lockdown, the unevenness of stimulus programs and so on, existing inequalities and problems are exacerbated and affect much worse the lower classes, the economically disadvantaged. That's where we have also massive unemployment. And with this massive unemployment, the prices drop. So we do have, to some extent, a kind of race to the bottom, both domestically and internationally. So in an environment where so many people in massive numbers are suffering and can be further exploited, how does one uphold social values and democratic values? And how is democracy and NGOs or the private sector to contribute to an answer to this challenge?
Should I answer?
Go ahead, and then.
Yeah. It's a very important question, and I think we have to take it in a largest perspective. Now, the most of the migrants are in their villages and in the towns. Now, they have their local problems also because they came out of that scenario in search of opportunities. Now they are back to the villages. For a few days, for few weeks and few months, they will be able to survive there. And if you go to the villages and the towns in India, some of the states are doing well. Like for example, Kerala, you find like even the small towns in Kerala and villages, they have access to some of the healthcare facilities and the businesses and all those things. But when you go to places like Bihar and Uttar Pradesh and West Bengal, where these migrants have gone now, and they are, as Madam Sindhu mentioned, that lack of confidence, or in few cases, they don't have any confidence. And they are prone to these type of exploitations which you are mentioning, that some of the political parties, some of the local people, some of the, all those exploitations are going to happen. And this has started because that is something which is the basic phenomena. I think the first measure which Indian government should take at the central level also and at the state level is to reorganize this entire workers' perception and their confidence and all that, recreate this confidence, and that is only possible when we will have one-to-one connection with them at the ground level. That is the first thing. Second thing, as people are a little bit, phobic with the Chinese, entire, perception about this whole situation and all that, and the way they have reacted to the whole thing, I think India can play a very important role in terms of the manufacturing sector and the industries and all that. And already some of the states have announced that. Like, for example, Yogi Adityanath in Uttar Pradesh has announced, but that is not an emotional announcement which is required at the moment. We need to have the tangible solutions to address those things at one-to-one level. Maharashtra itself is a big ground for the migrants and all that. In order to get back those migrants to Maharashtra, now there is a lot of fuss going on between the states. Maharashtra needs migrant after some time, the workers and all that. But some of the governments are saying, no, you need to put this thing, this condition should be there, then only we will send the migrants. So these type of things, at the end of the day is only going to create a lot of issues and problems. We need to create an environment where the state government should sync with the central government, and the NGOs can play an important role, because some of the NGOs, they are working in the rural development. They are working into the employment sector. They are working for the human rights situation, and they are doing commendable work in this crisis also. So to address that, it should be sync, and then it should be stitched in a tangible format.
Ms. Sandhu.
Mar, are you is it over, or would you like to say something more? Should I?
Please.
Yes.
I'd like to add one more thing to what Umar has just said, and that is there is a very good program of the central government which affords food security and employment to those in the rural area. That's called the Mahatma Gandhi National Rural Employment Guarantee Act, MNREGA. This has worked very well in the past, where funds are given and 100 days of assured work to every adult in a family who's willing to work. Unfortunately, this time during the budget, about 13% less allocation was given, but I must say very quickly the central government announced additional funds for the program. Now, it's all very well when there's an announcement and it appears on television news and so on, radio, but the funds have not yet percolated down to the districts. So I think the state governments have to very, very efficiently organize themselves so that the flow of funds to the various districts is there, so that at the district level, the district collector or the deputy commissioner, as he is sometimes called, the head of the district administration, can very quickly revive these works so that the promise of 100 days of assured employment is guaranteed to those who have come home, because I have had so many friends telling me about their domestic helps and others who've gone back and they are literally on the verge of starvation. The MNREGA works have not yet started. While on the paper they're all there, but it hasn't really started picking up at the rural level, not on the ground. That is an area that requires focus.
And another question that emerges from the comments that you made earlier regarding the distribution of funds with no accountability, with no auditing, without any oversight. Unfortunately, this is a trend that we observe in many countries. We have this concern in the United States. We have it in Brazil. We have it in Greece. Everywhere you look, you find handouts at the discretion of authorities that really do not want anyone to be looking. I wonder if supreme audit institutions, the equivalents of what the General Accounting Office that we have here in the United States, and the whole association of supreme audit institutions have a role to play, and some voice needs to be raised by academics and the media about this, because it's absolutely unacceptable.
Well, the academics have raised it. There is fortunately a public interest litigation pending in the Supreme Court about this. This is a special fund that was suddenly created with no accountability, no transparency, no auditing, and it got, as I said, over $1.27 billion in the first 50 days. So there's a huge amount of money sloshing around, and no one is allowed to look at the accounts and how it's being spent. Very unfortunate for a poor country like India, particularly.
Is there already something in India that are there some voices from the NGOs or from some media, or who is in fact trying to articulate a view on the reasons why transparency is what we need, especially at a time of crisis and emergency and quick decisions? Yes, you act fast. Yes, you address the problem, but you explain how. And if you find that someone takes advantage unfairly of that, there is accountability.
Well, like I said, the Supreme Court is already seized of the matter, and there is a public interest litigation pending before it. We'll have to see which way it goes, because it's quite obvious there was just no need to create this fund at all. There was already a Prime Minister's National Relief Fund, which people are always sending donations. It is audited by the Comptroller and Auditor General of India. It is open to RTI. And so this, with a great rush, the PM Cares Fund has been created as a trust, and it's absolutely opaque, and it's very, very worrisome. I agree with you. And I think right now the focus in the media is more on how you're combating the pandemic. But I think as time goes by, already there's a section, a very enlightened section, that keeps highlighting the wrong that has been done in terms of creating this new fund and questioning why it was done. But I think the Supreme Court and will be looking at this matter when it comes up before it.
Well, I certainly do hope
Kumar and I will be posted on that.
Because I regard it to a large extent as a false dilemma, the economic priorities and health priorities. You simply cannot run a healthy economy with sick people. And this is how you need to have the appropriate facilities. You need to have the right information. You have to take the right actions, and you have to do it the right way. It is the essence of governance. It is the essence of how people who are elected or appointed to serve the people, the societies, their villages, their communities, in fact, they had to promote that interest ahead of theirs, ahead of political or other considerations. So I hope that this is in the back of the mind of everyone. And another question that has come in is how the initiative on self-reliance that has been promoted by the government of India, how does that affect the economy? Does it reverse globalization trends? Does it undermine market efficiency?
I think I'll ask Umar to take this question.
Say again, I'm not able to hear you.
The self-reliance initiative, how does it affect the economy? Does it reverse globalization, and does it undermine market efficiency?
I think it is the time where a lot of technology transfer based manufacturing can happen in India. Because, like in today's time, India itself, is a big manufacturing and development hub for some of the industries. Like, for example, 20 years back, 15 years back, we were not having the manufacturing of some of the automobile sector, like, brands and all that, like IT sector, a lot of development happening in the RFID sector, security sector, textile industry, a lot of is happening in the areas of the FMCG sector. So I don't see that there is any sort of, yes, there will be a lot of, competition when it comes to China, when it comes to Taiwan, when it comes to Malaysia, all these countries. Definitely we need to come out with a better product, with a better efficiency, all those things. But at the same time, only announcement of Make in India, is not enough. I think the Honorable Prime Minister is very sincere. I'm very straight in this particular scene when he says that we would love to do everything in India in terms of manufacturing, and we should promote Indian manufacturing in a big way. But when it comes to the transfer of the responsibilities, for example, MSME sector, the banking sector, the nodal agencies, SIDBI is a nodal agency who is going to promote big time the local manufacturing, the startups and all those sort of things. I think somewhere they are greatly responsible that what the central government or the Prime Minister is talking, they should take and own the responsibility and should transfer those responsibilities to different level and hierarchical responsibility with the proper accountability. That is the need of the hour right now. Otherwise, to be honest with you, you go to a bank, they are suffering from all these NPAs and all those sort of a thing. When you go and talk with them, until unless you have a real penetration in that particular banking sector, it is not easy to come out with the desired outputs and all that. So somewhere the governance needs to be, for everything we can't just blame the central government. It is also the responsibility of different central government agencies, as well as the nodal agencies, as well as the state government and the banking sector, which has an independent and autonomous governance system. For example, SBI is there, SIDBI is there. They are not taking every order from the Prime Minister office. They can take a call. It depends that who is sitting there on that particular position. And that person and that management and that governance can play a pivotal role in creating this entire infrastructure. And I think it will be one of the needful and one of the must step that we need to revive the economy. All these parameters should be taken into the account.
Thank you. We have an example for Ms. Zandu, whether she has an example of how the center has discriminated against non-BJP states. Are there any examples, or is it just hearsay?
States have been complaining. Punjab, for one, has been complaining. They say, well, we hear of big money being transferred, but we haven't got our share. And the chief minister came on television to say that, and so have some of the other states. Hopefully, there will be a dialogue and it will be sorted out, or it is being sorted out, I would say. But several chief ministers have come online. West Bengal, for example, Punjab, others.
Yeah. Another example actually goes to the issue of integrity in the health professions and in organizations that relate to the sector. And reference is made to back and forth about hydroxychloroquine and remdesivir and a number of things that have been published in prestigious places. Some have been issued by the WHO, others in Lancet. And we found that the Lancet study is questionable. The results were retracted. There were problems with the way that the vetting of information has taken place and so on. And we can add to this a number of other things about non-symptomatic transmission, about the practice of companies coming out and giving press releases about tests or investigations or trials that they conduct without sharing the data about them. I think it is about time that we recognize that another sick patient that we have domestically and internationally is the health sector. It is the medical sector and the pharmaceutical sector. And we do need proper testing, proper sharing of data, and reporting with integrity. Yes, companies and others need to make money out of this and get a return on their investment. But their first investment is in the community health. And we cannot have any compromises on integrity and transparency. So I think that the overwhelming majority of health professionals would be with us if we call for integrity in pharmaceutical and medical processes in this rush to find treatments and vaccines that are both safe and have the efficacy to protect us, and they do not have side effects that kill the patient. So what I recommend, I do think that still medical journals in the Lancet are doing a good job and retract bad information when they find it. So the peer review of everyone is important. The voice of everyone in this is important. And it is not a regional matter. It is not a national matter. It is a global challenge. And we need to hold them accountable, and we need to support international organizations that do their best, try hard, and imperfect as they are, we need to support efforts to reform them so that they can become better. Better is the answer, not abolition or closing channels. And when you're talking about pandemic, when you're talking about viruses, you can't block them off. They do not need a passport or a green card to travel and work and do damage around the world. We have to realize that this is a common responsibility and a common problem, and only in consensual common approaches we will be able to address that. This was a question that was addressed to me. This is why I took some of this time, but please add your voice if you have something to say on this important issue.
I admire the Lancet for having had the courage to retract, because most magazines, and especially a prestigious one like Lancet, must have, it's wonderful to see that they retracted and they were ready to accept that there was an error in publishing a certain research document which didn't have adequate backup. But you know, I agree with you, Professor. There's not just a rush. There seems to be a race to be the first to reach the post. Each one wants to claim that we're the first to bring out the vaccine. Right now in India has a huge capacity to produce vaccines. It is has a very institutionalized and, a good infrastructure to take care of this. And they're already in the process of, they're in production to make a vaccine which has been done by, researched by Oxford and an Indian group of scientists. Now, they said we're willing to take the risk, the cost, because we feel that this is the vaccine, and they've already gone into production and they've started. I wonder if this is wise or this great hurry. It will take time. I mean, vaccines are not produced overnight. So while it's important,
I think somewhere
Go ahead.
Somewhere, I think the commercialization of each and every industry, particularly the healthcare, is also playing a very, very, a disastrous role in this situation. Of course, the research and development is very important. For example, I will give you altogether a different example. There is a Ayush ministry in India, and it has been observed that a lot of precautions from the Ayurvedic way of medicine, Unani, which is Greek, Professor Nikos, which is, very much in India, we have Unani, that is called like a Greek, a model of medicine. And
for the audience, you find a Greek.
Yes. For the audience, Professor Nikos Passas is originally from Greece. So our Unani medicine is somewhere synced with his heritage, So we have Ayurvedic, we have Unani, and then we have homeopathic. Now, these three areas, significantly they are contributing for the boosting the immunity in the Indian patients. And it is clearly observed, all these medicines are playing a very important role. And I am getting the information on a regular basis from Unani practitioners also, Ayurvedic also, and homeopathic doctors also, very sincere, very credible homeopathic experts and doctors. They are saying that some of the people or the system, they are not even allowing them to enter into the domain also. And they are saying, we are not claiming that we are providing you the medicine or some medicine or for the curing the COVID-19. But at least in terms of the immunity or precautions, we can take these things and it has no any side effects. But somewhere, these companies and manufacturers and even the R&D centers, I will not say anything about the scientists because they are definitely having a lot of sincerity towards what they are doing. But when it comes from the scientists and from the labs to the ground of manufacturing and creating the vaccines and all that and the medicine, that is an area where what Professor has mentioned is an area where we need to work in terms of the the real probity and the integrity, because it's a matter of healthcare. You are playing with the life of the people. That is something which the whole world is suffering. So in this time of crisis, at least people should have some sense, some probity and some integrity to contribute significantly and come out with the transparent output, whatever is happening.
Right, and to combine an answer to this challenge with the question that Sujit Vaidya has raised on whether there are alternatives to audits that are time-consuming and so on, it is important to understand that an audit is ex post facto. It is after the problem has occurred. It is after the damage has been done. What we need is also solutions about how to prevent these things from happening. And the answer is transparency to this. Yes, you have cultures of integrity that you need to promote. This is what we have been teaching here about what compliance and ethics means in how you run a business, how you run a university, how you run a government agency. But it is also about how you promote it, how you enforce it, and how you shed light, how you create watchdogs out of every single person. So we do need openness about where the money comes from, about where the money goes, and about what is the situation with a particular drug, treatment, vaccine, mask, ventilator, whatever it is that we need, so that people can be informed. We cannot have PR and press conferences run health policy. It's as simple as that. If we do this, we're going to end up like the current administration in the United States, after the FDA decided to stop the hydroxychloroquine prescription. They have tens of millions of doses of this drug stuck in their warehouses. And the taxpayer has to cover that expense. We don't need this, right? So we need science, we need objective facts, we need peer review. This is what we academics do, and we preach, and we think it is a good practice that everyone can follow. So this is the answer to government applications as well. Going further, there is another question also regarding the app that you mentioned, the Arogya Setu app, as a good practice, and we have seen similar ones from China and Norway to all kinds of countries. Some have been withdrawn as too intrusive, too vulnerable to abuse. How do we deal with this? I mean, what is a government to do and what is an individual to do with these apps?
In India, we're facing a lot of criticism on this app, that it's too intrusive, and that the government will have a lot of data on those who have downloaded the app, the users. But on the other hand, you can't deny that it's extremely useful in tracking and helping in identifying possible cases. So, well, we have to strike a balance, I would say. Very difficult question. But the government perhaps should have some inbuilt or legislations. The right to privacy is already recognized right in India. But there have to be more codification in terms of legislation so that this intrusiveness, if at all the governments wish to take advantage, a wrong advantage of the data that they're holding, that they will be held back. But it's a very tricky situation. I agree with you. Very difficult. Umar, would you like to say something about this?
Yeah, another thing that 100 million downloads, it translates into 10 crores. What about another 125 crores people?
This was on the first.
Because that is also Hello?
Yes, we can hear you.
Yeah. Yeah. So what I'm saying that it is a required tool, as Madam mentioned, that people are finding it easy to like deal with it while traveling and all those things. But two major issues are there. One is same like, you know, when it comes to like personal like information we are sharing with the government data and all that, which happened even in the case of Aadhaar also. So it is the duty of the government to come out with more and more like open like dialogues or advertisement campaigns, or with the local like councillors and MLAs and MPs. Like, you know, they need to engage with people that this phobia should go out. People are thinking the moment they will like track and they will do this thing and they will do that thing, that entire phobia should go out of the people. And that is the duty at each and every level in governance to address that entire thing. That is the first thing. Second, how to address the people. They are not having smartphones. They are not having access to the internet. Even some of the migrants, the majority of them and workers, they don't have access even to the mobile phone also. Or one house is having one mobile phone. So this is something we can't just depend on one app. Yes, it is quite informative. It is quite useful when it comes to like traveling by train or by bus and by like airline, and people are going in the surroundings and all that. But it should not be taken as a surveillance, because that is something people are fed up of, that everything, right from, you know, like our account number and our PAN number and our Aadhaar number, you know, is all exposed, and other like, you know, authorities know more about us than we know about ourselves.
Thank you all very much. We are having still questions. We are still lots of things. I wish we had 10 webinars to cover India and the issue. I would like to conclude at this point with answer to one question that came. In our opinion, does this pandemic set the world back, or is it the necessary devil that pushes us forward? And I would like to remind all of us the words of one of India's writers who wrote that pandemics have forced humans to break with the past and imagine the world anew. This one is no different. It is a portal, a gateway between one world and the next. We can choose to walk through it, dragging the carcasses of our prejudice and hatred, our avarice, our data bugs and dead ideas, our dead rivers and smoky skies behind us, or we can walk through it lightly with little luggage, ready to imagine another world and ready to fight for it. So I would like to end with this hopeful message that resilience has to mean more than preserving the status quo and going back to the old normality. And we have to imagine and fight for a new world that is better for ourselves and our children and our grandchildren. I thank you all for your contribution to this webinar, and look forward to seeing you to our next one, which is about the United Kingdom. Thank you so much.
Thank you so much, Nikos, Ms. Deepak, and Mr. Umar. Thank you so much for your wonderful presentations. Thank you, Pranav, Pidi, and Chirag for doing a great job making the program go smoothly. And thank you for your continuous support. Thank you very much for all your participations. And we're looking forward to see you at our next session in a couple of weeks. Thank you so much.
Thank you.
Thanks a lot. Thanks
Bye-bye.
a lot. God bless you.
Bye-bye.
That we didn't have time to answer all the questions.
Thank you, everyone, for your time, and we look forward to seeing you again.
Thank you all.
Thanks a lot.
Stay well and safe.
God
Thank
bless
you,
you all.
everyone, for joining
Thanks
in.
for your kind,
We'll be in touch.
Organizing the entire event, and it's a great honor to be with you all. Thanks a lot.
Likewise.
I'd just like to end by saying that the Mumbai community is also going to be planning a lot of events in the coming weeks. So just stay tuned, and we'll be rolling out the details very shortly. Thank you.
Thanks.
Excellent.
Thank you. Bye-bye.
Bye.
Bye.